So, hi, good evening, everyone, and a very warm welcome to our webinar on minor ailments this evening. It's lovely for you to join us on what I'm sure are very busy days in community pharmacy at the moment. I'm joined this evening also by Janice Oman, our NPA Representation Manager in Scotland. Janice, do you want to speak a little bit about what you do in Scotland for our members, please?
Yes, I'm here full-time in Scotland to support members access the NPA resources, make sure that the resources are suitable for Scottish members, that their needs are kind of getting met as well. I'm used as a point of contact for any queries and any support that they're needing. I meet with the stakeholders in Scottish pharmacy organisations, to gather, what are the needs, what's coming around the corner, so that the NPA can prepare members to be ready for whatever service developments or pharmacy issues are coming. Minor ailments, pharmacy in Scotland, minor ailments service has been on the go for a long while, well over a decade, but has recently gone under some significant changes and has been relaunched as a new service available to everybody in Scotland, free, and it's based around the pharmacy consultation. So I'm here to see if there's any questions that come through Scotland or any comparison, or if there's any Scottish members on this evening.
Brilliant. Thank you, Janice. And I should also add, of course, that Janice works very closely with the NPA representation managers for Wales and Northern Ireland as well. And that's Jonathan Rees and Anne McAllister, respectively. And all three of them work very closely also with our pharmacy services team in the advice and support services, with myself and my team of pharmacists, to ensure that we cover the whole of the UK. So moving on to the next slide, thank you. So the agenda for evening briefly is, I've done the introductions to Janice. I'll introduce myself as well for those who don't know me. I'm Jasmine Shah. I'm the Head of Advice and Support Services and Medication Safety Officer for the NPA. The part of the webinar today has been pre-recorded by a member of my team, Kinari Makwana, our Advice and Support Pharmacist. And following the main presentation, Janice and I will be here to take some of the Q&As and address any queries you may have. And then we will close, and we hope to complete this evening, hopefully by 8:15, 8:20 p.m. this evening. So next slide, please, Simon. Thank you. All right, so just thought I'd sort of give you a brief overview of what we will be covering today, because as Janice already mentioned this evening, the minor ailment service in Scotland is probably actually one of the most progressive and most established of the minor ailment services in the United Kingdom. Now, obviously, today's webinar is not intended just to cover the minor ailment services or to drill down into the depths of them. We will obviously talk about them a little bit, but it's broadly also to cover the types of themes and queries, and to address some of the things that me and my team hear through the advice and support services from what members come and talk to us about or ask us about in terms of how to manage minor ailments, period, either sort of through a surveys or over the counter. And I'm sure you'll agree that actually this last year has been even more challenging for everybody due to the COVID pandemic. But also there have been quite some challenges in how to effectively manage minor ailments during the COVID pandemic, with lockdowns happening, patients not necessarily being able to present themselves in person at the pharmacy, trying to sort of get the right information when you're trying to advise patients virtually, perhaps. So we will cover the continuing importance of providing minor ailments advice and support and service in the community, a brief overview of the different minor ailment services throughout the 4 UK countries, the current challenges, how to manage things effectively, and this is based on what we're hearing from members, where some of the challenges are coming from, and how you can help yourself as pharmacists on the front line providing minor ailments advice, and some of the key resources you can use to actually support you to provide really good minor ailments advice and support to patients, especially during this time when it's not always very easy to get GP appointments, and increasingly members of the public are turning more and more to their local community pharmacists to help support them with minor ailment requirements, self-care, etc. And we also just wanted to highlight some of the key legislative requirements with regards to OTC products when it comes to using them to support your patients look after themselves and treat minor ailments. So without further ado, I think we will start the main webinar this evening, and starting off with the first point about what sort of things comes under minor ailments. So Simon, if you could start Kinari's portion, that'd be great. Thank you.
Of course, thank you, Jasmine. Just give me one moment just to share that.
Thank you.
Hi, I'm Kinari Mukwana. I'm an advice and support pharmacist here at the NPA, working in the Pharmacy Services Department. So let's get into how minor ailments are an important part in pharmacies. So pharmacies play a huge part in minor illnesses, and they play an important part in diagnosing and investigating them. Also detecting if something would need onward referral. They are often the first point of contact for any health-related advice from many patients, just because they're so accessible in the community. And here I've just listed a variety of minor illnesses that we do come across in pharmacy. So, for example, we have things like back pain, common cold, headache, heartburn, and diarrhea and vomiting. So there are various schemes. There are various minor ailment schemes within pharmacies across the UK. So I'll just quickly run through what we have in each of the nations. So in England, we have the Community Pharmacy Consultation Service, the CPCS, and that is via the minor illness referrals from NHS 111. So what usually happens is a patient will ring up NHS 111 and then they'll be triaged to a nearby pharmacy. The patient will then have a consultation with the pharmacist, and the pharmacist will then provide the relevant advice, so the self-care advice or providing an over-the-counter product, or referring them onwards if it's something more serious, or even to another locally commissioned service nearby. In Scotland, we have the NHS Pharmacy First Scotland service, and that has recently been started on July 2020 this year. So that is available in all pharmacies in Scotland that dispense NHS prescriptions. You don't need to make an appointment, you just have to be registered with a GP there. Also, some NHS boards have additional local PGDs to cover conditions that are not covered in the NHS Pharmacy First Scotland service, so things like UTI and impetigo as well. There also is the NHS Pharmacy First Scotland Plus, where treatments can be issued by a pharmacist independent prescriber. In Northern Ireland, they have the Minor Ailments scheme, and very recently, they've recently launched the Pharmacy First service for winter ailments, and that will run from November 2020 to March 2021. So the Pharmacy First service allows eligible patients to use their community pharmacy as their first port of call for management of winter ailments, such as sore throat and common cold, and also for the remote management of COVID symptoms. You must be registered with a GP in Northern Ireland to access the service, and the consultation can take place by phone, video conference, or in person at the pharmacy, and that is at the discretion of the pharmacist. In Wales, we have the Common Ailment Service. So registration is carried out at the time the service is required. A pharmacy cannot register patients in advance of the service being required. And pharmacists can then provide medicines from the Common Ailment Service formulary as well. Also, we have general over-the-counter advice and sales in all pharmacies. So, minor ailments are more important now than ever to reduce the pressure off the NHS. Many over-the-counter treatments do not need to be seen by a doctor. Pharmacy teams are extremely knowledgeable and well trained on this. Certain parts of the country, I know in England, have an NHS policy for not prescribing for minor ailments on prescription, because often the NHS cost is higher than just buying it over the counter. Also, we've seen increased demand in over-the-counter treatments as people are more aware of their health at the moment, and they want to get that treatment for them, especially during the pandemic. People are more aware of their health at the moment. We also have it also links to the essential service of self-care in England. In Scotland, they have the Public Health Service, which consists of 4 elements. So one of them is a health promoting environment. in Northern Ireland. We also have various campaigns such as the Living Well campaign. There have been new minor ailment services being introduced in different parts of the UK. So as I mentioned, that recent winter ailments service in Northern Ireland as well. And it's also in line with being a healthy living pharmacy, where pharmacy teams provide information to patients about their health and promoting a healthier lifestyle and supporting them to do so as well. So minor ailments, who can provide advice? So pharmacists, pharmacy technicians, dispensers, pharmacy assistants, pre-registration pharmacists, and medicines counter assistants. But please note that you must complete the accredited medicines counter assistant course or the relevant units of the GPHC recognised dispensing assistant or pharmacy technician course. Just to let you know here that the NPA do run a medicines counter assistant course, and further details can be found on our website. It's also really important for pharmacy staff to know signs of when to refer to a pharmacist. And I'd also mention here that it's important for a team to work together. Providing this kind of service is a team effort, so each person can play a different role. So for example, the pharmacist may have better clinical knowledge, and the counter assistants may be knowledgeable about the products that we have in the pharmacy. So the current challenges of minor ailments. So with the new pandemic, there have been many new challenges. There have been increased pressure on pharmacies and the NHS during this time. Pharmacies were open throughout the pandemic, and many people relied on them to get healthcare advice and medication. Also, there have been winter pressures with an increase in more infectious minor ailments, and more people are coming to the pharmacy to get those resolved. People are more worried about their health issues, as I mentioned before, where people are more aware of any kind of symptoms they may be feeling at the moment and wanting to get them checked out. Patients may be more reluctant to visit their GP or pharmacy due to the risk of contracting COVID-19. We have a lot more people staying indoors, especially during the lockdown. People also may be self-isolating or clinically vulnerable. So patients may not be physically present at the pharmacy. So they may be actually ringing up the pharmacy instead, or asking representatives to come and collect their medication or to obtain healthcare advice on their behalf. Also, it's also hard to diagnose the difference between cold versus flu versus COVID. The symptoms are very similar, and I'll be discussing this later on in more detail. And in certain parts of the UK, we do have increased referral from NHS 111. So now I'm going to talk about COVID and minor ailments. So pharmacists have been operating services in a COVID secure environment. So that may be having perspex screen, trying to maintain that 2 meter social distance, wearing the face coverings. And COVID symptoms are very similar to other minor ailments, such as things as sore throat. Many pharmacies may not be seeing patients face to face, which I mentioned before, so patients will be calling the pharmacy for advice instead. Limited patient access in the pharmacy. Some pharmacies are seeing patients through a hatch and may not get to actually assess the patient themselves. You may have to undertake a telephone or video consultations with patients to overcome these kind of barriers. But there are challenges of undertaking these types of consultations over the phone. So you can't really assess the patient visually. So for example, if they are discussing a rash, you may not actually be able to see the rash that they're talking about and make the correct diagnosis. Also, when undertaking things over the phone, it's quite hard to understand who the patient is, so you need to confirm who it is. So often it is a parent ringing about their child, or somebody may be ringing up for a friend or family. So now we're going to talk about flu versus common cold versus COVID. So as I mentioned before, the symptoms are very similar. So here I'll just briefly touch on what the different viruses are. So COVID is a viral infection caused by coronavirus. It's spread through the droplets of saliva or discharge from the nose of an infected person. Most people who contract the virus will experience a mild to moderate respiratory illness, and the best way to prevent an infection is to avoid being exposed to the virus. So that is in line with the government guidance of wearing the face coverings and having the 2 meter social distance. So flu is highly infectious and it's an acute viral infection of the respiratory tract. It affects the nose, mouth, throat, bronchial tubes and lungs, and it occurs during the winter months in an 8 to 10 week period. The cold is a mild viral infection of the nose, throat and upper airways, and it's common in all age ranges. It's spread through inhalation of small particles that remain in the air by direct skin contact and or transmission of large particles formed when sneezing or coughing. So here I've just highlighted the fact sheet that we have on the NPA website, and that's recently been launched at the beginning of November. I've also just included a link of where to actually find it on the NPA website. And this is a really useful document, I would say. It outlines what the different symptoms are, what the symptom management is, and what to do in each of those cases. So as you can see, the table is really useful and that outlines the different symptoms of the 3 viral infections. So with COVID, you have the new and continuous cough. So that's coughing a lot more for an hour or 3 or more coughing episodes in 24 hours. With the flu, diarrhea and vomiting is most common rather than in COVID and the cold. Also with COVID, I'll just mention you have the loss of smell and taste. And with the cold, you can get like a pressure headache, which is more common in the cold than with the other 2. And that's just because of the fluid buildup, or it's like a sinus headache. So symptom management is similar for all of them. So that's rest, drink plenty of fluids, paracetamol, and washing hands. But with the COVID, there's also the social distancing and advising the patient to get a test if they have symptoms as well. So top tips for ensuring an effective minor ailment service. So you need to be confident with this service specification, have up-to-date knowledge of the common minor illnesses in community and treatment, knowledge of red flag symptoms and criteria for referrals, which is really important. And it's really important also to recognise when it's not a minor ailment. So when it could be something like another drug interaction or a side effect from another therapy, or maybe even an underlying serious condition. So when you recognise when it's not a minor ailment, we need to follow patient safety and keep patient safety in mind. So we would undertake the yellow card reporting, and pharmacy team should remember to report any kind of adverse reactions and any patient safety incidents as well. Also, you need to be aware of the legislative requirements, which I will run through briefly later on. Also, good consultation skills and the appropriate record keeping is a must. So now I'll just run through some of the resources that we have. So here is the self-care and signposting resource, and that is for all countries in the UK. So firstly, we have the self-care and signposting directory. I've just put a snapshot of the England one here, but we do have one for each of the countries, so Scotland, Wales and Northern Ireland as well. That's really useful because it highlights all of the kind of local services and numbers and websites where you can refer patients onto. We also have the NHS Public Health Campaign log, so you can list down when the campaigns are taking place and what needs to be done there as well. We also have a signposting log, and also similar to that is the self-care log, where you put down the date that you saw the patient, what they need to do, what advice was given as well. And we also have a self-care and signposting guidance, and I'll just reiterate that this is for all countries in the UK as well. That is in the Ops pack of meeting NHS contractual requirements, and I'll add in the link in our resources. We also have the self-care and signposting SOP. That's an England only resource, and it's really useful because it has an easy to follow diagram, and they also have a section of when to refer to a pharmacist, which I think is really useful. So even though this is an England only resource, it can be useful for other countries in the UK as well, and just to have a look and a reminder of what needs to be done. We also have the Sale of Medicines SOP, and that is UK-wide. So again, that has that easy to follow flow chart. And then we have pointers such as patient assessment before over-the-counter sale, where to look kind of guidance as well, and legislative requirements as a legislative requirements table, which is really useful. Consultation skills. So what does a good consultation look like? So it must be patient-centered, and that is in line with the GPHC standards and the PSNI standards of always pushing the patient first and providing patient-centered care. Active listening, effective communications, which is also in line with the GPHC and PSNI standards. Using clear, concise language. So making sure that you're using layman's terms, using language that the patient can actually understand. Appropriate questioning, using open and closed questions when needed, and also signposting. And here I've also included a few links to consultation skills training that is available for our members. So personally, I've actually undertaken the CPPE consultation skills, and I found that really helped me. It helped me to facilitate consultation and help consider a holistic approach to the patient as well. We also have the NES consultation skills for our Scottish members and the NICPLD for our Northern Ireland members. There are different types of consultations, and we have to be adaptive in the current climate. So sometimes a technology-based communication may be a better approach. So the use of virtual consultations has been discussed by the NPA Policy and Practice Committee, and they have issued the following principles. So a face-to-face interaction where patients and pharmacists meet in person is vitally important. Not all healthcare interactions may require a face-to-face interaction, but patients ought to have access to face-to-face support when and where they need it. Technology is an enabler for effective continuity of patient care, but must not replace current models of care that enable personal contact with the pharmacist. So a hybrid of consultations is to be available in order to meet patient needs. So in terms of having a virtual consultation or undertaking a virtual consultation, it may be a suitable option for those who are self-isolating or those who are clinically vulnerable. And they should be made using a secure pharmacy line or a video application. And you must obtain the patient's consent to do so. You need to ensure that the consultation can be conducted in a private area of the pharmacy, so somewhere where you can maintain patient confidentiality. So that may be the consultation room. You need to ensure that you have a method for verifying the patient's identity, such as their full name, date of birth, and address. So some pointers to actually help conduct the virtual consultation is introducing yourself and ensuring the patient can hear you clearly. Inform the patient that you'll be making notes on the patient medication record or the customer record form, and also gain the consent to do so. It's often, pharmacists often forget that patients may still require a chaperone over a telephone or video application. So you would still need to ask the patient if they would like somebody to be with them to support them during the consultation as well. And it's really important not to forget that. Also to summarize the conversation at the end to ensure the patient is aware of any advice or actions that need to be taken. I would also say that you need to ensure that both the pharmacist and the patient can use the technology confidently, and you'll need to assess if it's appropriate for this type of consultation to be carried out. The NPA will also be releasing some kind of guidance on this in the near future as well. So providing minor ailment services and advice. So to ensure a effective service, the pharmacist will need to ensure they are able to communicate with and advise the patients appropriately and effectively on minor illnesses. You're also able to identify the red flags when assessing patients clinically. You're also able to make suitable referrals to other NHS services and healthcare professionals, and also are able to explain the service to patient and carers as well. So here at the NPA, we do have red flag sheets, which are for our members to use. So here I've just listed in one example of fever in children. It's really useful. So they have like a whole table in red to say the red flag symptoms, and then also other general information on patient self-care and where you can find more information. And I would say that it's really important for pharmacists to identify these during the patient consultation. And here I've just listed in the NPA red flag sheets that we do have. So these are all the conditions that we have made red flag sheets for. I've also included here the resources that may be useful for our members as well. So NICE, the clinical knowledge summaries, and I've just put an example here. This is for our England, Wales and Northern Ireland members. So here I've just listed in cough, and it's really useful because it talks about the prescribing and management of them as well. And here you can see that they've also put like a little a question section of what to actually ask when taking a history and things to be aware of as well. And I'll say it's a really useful guidance to use. Here I've also just mentioned that the yellow banner, which says read about our approach to COVID-19, NICE have recently launched a COVID-19 section, which is really useful as well. NICE also have the traffic light system, and that's for identifying the risk of serious illness in children. So just a note here, infant or a child will fall into the amber or red risk category if they have any of the relevant clinical features. And I've also just included where to find that as well. For our Scottish members, they have the sign guidance. So here I've included an example of atopic eczema, and it's really useful and it highlights the different treatment options, and it's definitely a good source of reference guide to use when needing further information. It also talks about when to refer the patient on and the steps for treatment therapy as well. So going on to record keeping. With each minor ailment service, they have different record keeping requirements. So I'll just run through them country by country. Starting off with England, you would need to record the information on the patient's condition so that it can be made on the CPCS IT systems, which are Pharma Outcomes or SONA. You would also need to record any over-the-counter preparation supplied to purchase as part of service, and also details of referral and outcome should be made on the system. That information should also be included in the GP practice notification form. In Scotland, we have the Universal Claim Framework, and you need to record down any advised treatment or referral made. No signature is required from the patient unless specified in a PGD. In Wales, they have the Common Ailment Service, and that would be recorded on the Choose Pharmacy platform service. And in Northern Ireland, for the Minor Ailment scheme and the Pharmacy First scheme, then we'll have the pharmacy consultation form and pharmacy voucher that needs to be completed, and that is not electronically, just to bear in mind. Also, for general over-the-counter sales, there are no record-keeping requirements, but it may be useful to actually put what you've sold to the patient on their PMR. It's not mandatory, but can help for future treatments. And you can log that on using the NPA self-care or signposting log. If any patient details are kept, then you need to obtain patient consent to do so. Key considerations when assessing patients for minor illnesses. So, children, doses vary a lot for children, and it's a lot of differences between the age and sometimes even the weight. You need to be aware of what can be sold over the counter for children as well, and you need to be aware of when to actually refer onwards. There is no legal minimum age limit for over-the-counter sales to children, so pharmacy staff should refer to the pharmacist, and the pharmacist should then use their clinical judgment. Also, it may be useful to ring up the manufacturers to confirm what can be used and what age range is suitable. And this is also particularly important as licensing for each product for over-the-counter supply for certain age groups is different and can vary, and you need to be very aware of who you can sell it to. And that's also with pregnant and breastfeeding women where items may not be suitable for them. You also need to be aware of the professional standards and the UK legislative requirements and keep those in mind. Recent products that have had POM to P switches, they have materials that are available to assist with the appropriate supply. So things like Viagra, Elawan, Lebanel, Malof, they will have additional questionnaires that you can ask the patient, or materials that can help the pharmacy teams to actually make that supply to a patient. Also here, I'd just like to mention the change in stimulant laxatives, where stimulant laxatives on general sale will be recommended for use in people aged 18 years and over, and they should no longer be used in children under 12 without advice from a prescriber. And children aged from 12 to 17 years can be supplied under supervision of a pharmacist. We have the stimulant laxative NPA resource and SOP and checklist as well. So now I'll just run through the UK legislative requirements. So I've just created a table here, so that outlines the particular requirements for specific drugs. So for example, the aspirin and paracetamol, it's just a reminder that a maximum of 100 capsules or tablets can be used. For codeine and dihydrocodeine, a maximum pack size of 32 tablets or capsules. So these products are usually only used for short-term use, and customers requiring treatment periods in excess of 3 days should be referred to their doctor. Pharmacy teams should also be aware of patients who may be buying these products repeatedly and frequent requests for them, and they should ring alarm bells, and you should flag up to your CD accountable officer. With pseudoephedrine and ephedrine, a maximum of 720 milligrams of pseudoephedrine or 180 milligrams of ephedrine should be supplied. You cannot sell pseudoephedrine containing products at the same time as ephedrine containing products, irrespective of the strength and the total quantity of the active ingredients. And again, I'll just remind the new changes in the stimulant laxatives, where the pack sizes of GSL stimulant laxatives are restricted to 20 standard strength tablets, 10 maximum strength tablets, or 100 ml of oral solution. So now moving on to the NPA resources that we have for members. So these are the UK-wide resources, and I've just listed them here, and I've also just put in a picture of self-care and the signposting guidance. As I mentioned earlier, the Ops Pack, which have the directory, the campaign log, and the guidance there as well. And I've just listed what else is in the Ops Pack there. Here I've listed in the NPA resources for members, and those are country specific. So for England, we have the CPCS pack. For Scotland, we have the Pharmacy First Service SOP. We have the NHS Pharmacy First Scotland Service Hub as well. For Northern Ireland, we have recently launched the Pharmacy First Winter Ailments SOP as well. Okay, so we do have other NPA resources that support our members. So we do have a variety of webinars, resources, guidances, training courses, and we do update the NPA website regularly with the recent news stories as well. We do have resources as well, and these are the resources that I've used and mentioned within the slides. So here we have the CPP toolkit, the NHS CKS guidelines as well, and the PSNC Community Pharmacy Consultation Services pack as well. This slide can be used for all members as well, but it's mostly aimed at our English members. And here I've listed our resources that are country specific, so the Pharmacy First Scotland Hub, the Welsh Common Ailment Service supporting documents, and the Northern Ireland documentations for the Pharmacy First service in that country. And now I'll pass over to Jasmine. Thank you.
Hi, everyone. Thank you. So that's the end of Kinari's presentation this evening, where she's covered a variety of different topics. Now, I would like to add a few points to Kinari's presentation to actually just underline some of the things. Now, as I mentioned earlier at the beginning, some of the material that Kinari has covered, you may perhaps think, oh, this is quite basic. Why are we talking about this? However, the reason we've chosen to do that is because of a webinar and the content we've covered is based on the types of queries we have coming to the advice and support line in terms of what are the key things that our members are querying about or not sure about to help clarify this. So I think a couple of additional points I would like to mention. And forgive me, I keep looking away from the screen a little bit because my second screen is a little bit on the side. I'm just referring to my notes. So in terms of one of the things that is a little bit of a concern that has occurred a couple of times is what we're hearing is at the moment, where pharmacies are operating in a COVID secure manner, and as Kinari has mentioned, in terms of having the clear screens in front of the counter to help protect pharmacy team members, potentially wearing masks as well, and also trying to have their patients or customers keeping a distance away from the counter, as well as them wearing a face covering or a mask. So what this is all adding up to is potential difficulties in having a verbal conversation between the pharmacist or the pharmacy team member on the counter with their customer. So we've heard a couple of instances now where some complaints or concerns have been brought up by patients or customers where discussions about minor ailments, where the customer is asked to describe the symptoms or talk about sensitive items potentially, has been conducted over the counter, and there's a clear lack of privacy in the way that happens, and it also doesn't help to maintain patient confidentiality. So I think one of the considerations you may want to think through as well, and I'm sure you've probably done all this already, is how can those conversations happen in a more confidential manner while maintaining the COVID secure ways of working, for example? Is it possible to use the consultation room to make sure that the conversations can be had properly, confidentially, and in a private manner? Because what we've heard is a couple of concerns where patients have raised concerns where the pharmacy team member on the counter has asked them to give the information in a louder voice than normal, meaning that everybody else in the pharmacy can also hear them, and that actually causes a concern from a confidentiality and privacy manner. So just something to be aware of, and you may want to take a chance to review again how the setup works in your particular pharmacy and what systems you put in place to help maintain patient confidentiality and privacy as well. With recognizing in terms of the sale of medicines standard operating procedure and protocol that Kinari has referenced in her slides. Sorry, Simon, if you could have the next slide with the Q&As, please, that's fine. The reason I would like to highlight that is because that is actually quite helpful, because under most circumstances, it's not going to be the pharmacist who is the first person to be encountered by the patient or the customer. It is likely to be a member of your pharmacy team. And it's a useful aid as well in terms of what sort of questions your pharmacy team members should ask the customers, how to recognize when to refer to the pharmacist, perhaps not just for symptoms, but for products as well, which ones can only be sold under the supervision of a pharmacist and with their advice. So it's a very useful tool also, not just for the pharmacist, but the whole pharmacy team, and which can help really support you in managing minor ailments queries over the counter. And there's no reason why it can't actually also be used to support minor ailments services as well, in terms of ensuring that the right information is gathered from your patient or customer. The other key point to highlight is, as Kinari has touched upon, is the language. Now, there's two ways to look at this. We come across this once or twice again where, it's not appropriate to use clinical language with your patient or the customer. Now, I know you're probably thinking, God, that sounds so basic, but it's been known to happen. So things like using words like pyrexia, when you could use a more layman's terms in there and maybe say, do you have a temperature? Have you had a fever? Which is more easily understood by the non-clinical customers and things. Now, one of the other main things is a recognition of sepsis. So this is again where some of the resources we've signposted to in terms of the CK's traffic light system and things, it can really help to identify and pick up sepsis and recognize the symptoms. Now, all of these things in terms of having the right conversations to identify minor ailments, what treatment patients require potentially, what self-care advice to give, all of these things have been made harder in the last year for multiple reasons. One of the reasons is, as Kinari's already covered, is that a lot of patients are now ringing up the pharmacy and speaking over the phone, so you don't necessarily have the patient in front of you. You're also, we touched upon some of the challenges about speaking with patients and customers within the shop floor in terms of pharmacy area and maintaining confidentiality and privacy. Now, English members will be aware that there has been a terms of service change in recent weeks whereby it is now a requirement as part of the NHS terms of service for pharmacists in England to ensure that they have the provision and ability to provide remote consultations to patients as required. Now, so part of that is a checklist. So what we are developing in terms of resources for our members at the moment, and they'll be available shortly, is FAQs, some of the questions we're being asked, and we're covering that information off, as well as guidance on conducting remote consultations, virtual consultations, and a checklist as well in terms of what sort of considerations should you have in place. And this will be things like technical considerations. There'll be practical considerations. There'll be how to prepare for an effective virtual consultation, how to start it, how to introduce yourself, communicating properly, how to close it off, what to do after the consultation, what sort of advice to give to patients. So these are quite detailed resources that we're in the process of just preparing and to be available really, really shortly. So please do keep an eye out for that. Now, we receive routinely many queries on children's medicines and children's doses for treating minor ailments over the counter. And as Kinari's touched upon, there are some of it is legislative requirements in terms of how many doses of particular medicines you can supply over the counter legally. Other questions are around what medicines are licensed for which specific conditions over the counter. And one of the things to highlight is when you're supplying medicines over the counter, you can only supply it within the product license of that particular medicine. So you cannot supply medicine over the counter and sell it as a P or a GSL line for a condition which it is not licensed for that over-the-counter use as a P or a GSL medicine. And that is really, really important because if a patient requires treatment where there isn't a licensed over-the-counter product available, then they should be referred to their clinician, their GP, their doctor, for further assessment and a prescription for the treatment that they do require. And this is quite important. Also the age limits, because product licenses undergo changes from time to time. For example, there might be changes in what they're licensed for. There might be changes in the doses for children as they're adjusted. So it's quite important to ensure that you keep up to date with that. And the best way sometimes to find the information readily at hand is simply to look at the patient information leaflet, which should have the latest version of the licensing information in that. Now, Kinari touched upon the sale of codeine products, and I would like to highlight that we've recently also become aware of an issue with the sale of codeine linctus over the counter. And this is something that is causing some concern for the regulator as well, where certain pharmacies have inadvertently perhaps even sold large quantities of codeine linctus. And it seems to be linked to the fact that it's not just one patient repeatedly requesting codeine linctus as over the counter, but there are multiple patients, so it's harder to make the link, but it seems to be almost like an organized activity at a local level. So please do bear that in mind. And if you start to see a request for coding link tests over the counter increasing, then please do bear that in mind. Do question it, and think about how much coding link tests you may supply in the regular course of your business to see if it is increasing significantly. That is a local concern, and please do flag it up with a local CD accountable officer as well. It's quite important to look out for these things. So there are some of the things to matter. Now, as always, if you come across any patients or customers and they report any concerns regarding adverse reactions or anything, please do bear in mind that you are able to use the yellow card report to highlight these concerns to the MHRA, and that is really important from a patient safety perspective as well. Now, Kinari has already covered about record keeping in there, and whilst there is no requirement to keep records when you supply medicines over the counter, I mean, not as part of the minor ailment service, but literally just over the counter, the time that it becomes important to have some sort of a record is if there is a patient complaint or a claim is made. So, and I've discussed this at length with my colleagues in the NPA insurance in terms of professional indemnity as well. And good record keeping always helps. So if you are supplying something over the counter where you think, actually, you know what, let me make a record of this for whatever reason that you feel is suitable, or where an over-the-counter sale is perhaps refused as well and the patient perhaps is not happy already, or whenever you feel is possible, please do try and keep a record, because there have been cases where in the event of claims or concerns or complaints arising, a good record will go a long way to helping to resolve the complaint or a claim very quickly, and it really supports the entire process should it happen. We, of course, hope that you don't get any claims, but these things can arise for various reasons. So I think that's why we would stress the record keeping is quite important, as well as maintaining the required records for any services for minor ailments that you do provide. So I hope that that's given you an overview, as I said, because we've based today's points that we are raising and considerations based on a lot of the questions and queries we get on how to manage minor ailments over the counter and things as well. So I hope it's some use to you. We're happy to take any questions. And Janice, may I ask at this point if you wanted to, it'd be good if you could add something from the Scottish perspective in this, a good addition to what we've covered already, perhaps.
I think what you've covered, there's so many kind of facets to minor ailments, and there's so many different variations of different types of services. I think it is having the resources there and your team fully aware of what they need to be aware of, particularly those red flags, the sales that are against the kind of legislation, the red flag, the red alert sheets are fantastic resources. They really are a really good kind of training aid to use with your staff just as a refresh, or if you're just kind of doing some quality improvement activities. They're just so clear, great to use. The signposting log as well is an excellent thing and kind of fits in well with GPHC and kind of inspection. I did make a comment in the chat that thinking about where you refer to with minor ailments is also, quite an important part. It enables you to build relationships with other health professionals around you. It supports the patient getting the best support if you cannot, help with the minor ailment. We have a new example of a referral pathway from community pharmacy to optometry, and absolutely fits perfectly in with the minor ailment. Somebody comes in, you look at their eye and you think, no, they really need a proper eye examination. It's not really urgent, though. I don't think they need to go to A&E in the hospital, but knowing who the optometrist is, how they will take referrals from you, when they're available, is there a prescriber within that optometrist? It's really useful information. So it is about reaching out to thinking in your community, how can that minor ailment service really be part of the full patient care within the area, and that's the kind of thing that using it with the other health professionals and letting the GP surgeries aware of how you're kind of working as well. It lets people understand what the minor ailment service is, and then it lets them refer patients to us in pharmacy. So it's definitely a kind of win from that. That's probably my main take out of it, I think.
Yeah, no, that's really helpful, Janice. You're absolutely right. And some of the resources that Kinari has highlighted, like, the signposting directory and things, well, there is a starting point in there. It's helpful to sort of look up this information locally to yourself as well, and to have that ready at hand, and that would be quite helpful. And of course, at the moment, there is much more recognition required, I guess, as for mental health as well over the counter, in terms of what patients, customers, and everybody's might be experiencing, or sort of not feeling great, perhaps because of the lockdowns, not being able to see family, friends, and where different areas of the country have been in lockdown for longer periods of time. So even knowing sort of where to signpost locally for additional support and help, that would be helpful as well. Now, we've had a question come through from one of our listeners this evening, Janice, and this is something that we have come across before, where patients who routinely keep asking for medicines which are subject perhaps to misuse, and we've seen numerous examples of specifically things like codeine-based products over the years, essentially, and pharmacists and pharmacy teams will rightly be wary of, let's say, individual patient making repeated requests, and they may have refused the sale of it as well. And we've definitely come across this, where the patient then is not happy with the fact that you're refusing the sale, and they go and leave a bad review about your service online, which is so easy to do these days. And where these things needs managing, if you do experience things like that, where something, for example, which is untrue, not true, has been posted and things, then our press office team and our colleagues at the NPA may be able to help you, support and advise you on how to manage that from a online and social media perspective. So please do reach out. Your first port of call should be the pharmacy services team, where we can take down your query and then ensure that the right person contacts you back in terms of how to support you. And this has happened where, for example, if I can cite a really worrying incident that happened with one of our members, whereby they had this conversation, they refused the sale of something, and then the patient turned around and said, well, I've been recording you all this time on my phone camera, and then used that to post it online on social media, and it was a really poor situation. And my colleagues in the press office were actually able to help support that member in terms of how to rectify that situation. So if you do experience something like that, please do reach out in that sense. So thank you for that as well. Janice, would you want to add something else to that? Because we've seen an increase in this, haven't we, about patient frustration and people not feeling great?
I think as a professional, with the patient's care at the absolute centre of everything we do, that patient requesting that and hopefully being referred to a trained member of staff that can provide an opportunity of actually explaining about why that patient has to seek further referral, how it's not a minor ailment if it has to carry on, or to be have the risks of what they're doing explained to them, so that how they may be putting their own health at risk. Example obviously being your non-steroidals, repeated use of them, the damage that they could be doing. So, we're there as professional and the expert in medicine, so we shouldn't be afraid of saying no, but hopefully it's an informed no. Yes. And if that patient then, gets us a bad review on Google, we're about the patient care. We're not about the Google grading. And if that patient, maybe they're irate and they put that Google review on, but perhaps that information will start sinking in. They'll maybe hear it again the next time that they request for it, that might make them make that trip that they're being told, yes, you probably should see the GP about it, or do you want to tell us more about it, and have a fuller discussion. So personally, I suppose being a community pharmacist for a long, long while, I have no qualms about saying no. And
Yeah,
we're not
absolutely.
there to be everybody's friend. We're there to be supportive and look after their care.
Yeah, and that's absolutely true. And as Janice quite rightly said, is patient-centered care. What is in the patient's best interest? And if someone is coming in week in and week out requesting the same medication, then clearly there is a long-term chronic thing, and it's a matter of that conversation. But yes, you may even encounter situations where you've done everything, the pharmacist has had the consultation, you've spoken with them, informed them of everything, and they may still not be happy, and this does happen, unfortunately, and perhaps there might have been an increase this year, Janice. I think based on what we are hearing, I think patients are becoming more frustrated, and it's not even necessarily because of the pharmacy team. It's just generally with the whole pandemic situation that we're all finding ourselves in as well, isn't it?
Yeah.
As well.
Yeah, and I think perhaps if a patient had heard the same message a couple of times, I think you need to go to your GP, they would in normal times maybe have gone to their GP, but because of just the barriers that have been put up to be able to get in front of the GP, they're less inclined to make that trip. So they are taking their frustrations out in other ways.
Yeah. Not that we would say that, it's not acceptable, of course, that pharmacy teams are treated badly in any sense or form. It should not be the case at all. Given the fact that our members and community pharmacists have been open and available to provide that, frontline patient care throughout the entire pandemic since the beginning of the year, it's a matter of ensuring that, the profession and the sector is respected by everybody across the board. Absolutely. So, no, thank you for that. And I think that's been helpful. Obviously, it brings us nicely. I think we're probably overrun slightly because we're aiming to finish by 8:20. So thank you very much for bearing with us. Simon, are you able to advise regarding the availability of slides, please? That would be helpful before we sign off for the evening.
Of course, yeah, thank you, Jasmine.
Thank you.
Yes, so the recording for tonight's webinar will be available on the NPA website from tomorrow morning. So if you go to the NPA website, go to the news events section, and then it's past events, you'll find recordings of this event and all the other webinars that we do. And obviously contact details are on the presentation slides as well. So if you want to follow up with Jasmine or any of the team with any questions, you can do so. But yeah, you can watch that at your leisure from tomorrow morning. I'll aim to have it on there by about 10, 11 o'clock. We'll also send out an email as well, just so you know when it's available.
Brilliant, thank you. And I just wanted to say thank you to Janice again, because while we've been covering this, Janice has very helpfully been posting some really good links in the chat function as well. So hopefully that will be useful. And just also want to thank my colleague Kinari for preparing this and liaising with this basically. So thank you all very much. And please, as I said, the contact details for the advice and support team are on the slide at the moment. If you wish to actually speak with any of the NPA country representation managers, which is Janice or Anne or Jonathan, do also get in touch with us, and we can certainly put you in touch with them. Is that okay, Janice?
Yes, absolutely. Yes.
Yeah, and we're always happy to help. So thank you all. And once again, thank you for all the hard work that you're doing to support patient care throughout the pandemic as well. And I'm sure, I hope this minor ailments has been a little bit of useful to cover this. Look out for our resources coming soon on the virtual consultations, which should also help you. And just thank you for joining us, and have a good evening, everyone.
Thanks, Jasmine. Good night.
Thank you.
Bye.